Hello, it's me, Dr. Taimoor Hassan. I'm here with the Medical World series. First, we are going to start off with the ECG. Now, what is ECG? ECG is a line graph that shows changes in the electrical activity of the heart over time. It is made by an instrument called an electrocardiograph. Here is the basic waveform of the ECG, where we are having P wave, QRS complex, and T wave. In this video, we are going to start with the basics of ECG. We will start with ECG interpretation, that is the waveform, segments, and intervals produced in the normal ECG. The first thing that is produced on the normal waveform of ECG is isoelectric line. Isoelectric line is a straight line that is produced on the ECG waveform. On the isoelectric line, there is no electrical activity of the heart. The P wave QRS complex will be produced. QRS complex is basically ventricular contraction. Ventricular contraction, again, this is depolarization. Depolarization is the contraction of whether atria or ventricle. So ventricular depolarization is the ventricular contraction. And the waveform produced on ECG waveform will be QRS complex. After QRS complex, T wave will be produced. T wave is produced by the ventricular repolarization. Repolarization is basically the relaxation of the ventricle. So ventricular relaxation will produce T wave on the ECG waveform. Now we will move on to the intervals. The first interval we are going to look at is the PR interval. PR interval is basically start from the beginning of the P wave to the beginning of the QRS complex, as demonstrated in the above figure. This also demonstrates the conduction of electrical activity through the AV node. So PR intervals start from the P wave up to the start of the QRS complex. Next interval we are going to look at is the QT interval on the ECG waveform. QT intervals start from the start of the Q wave and end at the end of the T wave, as it is given in the above diagram. QT interval is basically the electrical depolarization and repolarization of the ventricles. Next interval is the RR interval. RR interval is basically the time between QRS complexes. It is used to identify the rate and regularity of the ventricular contraction. Next thing we are going to look at is the ST segment. ST segment is the end of the S wave, which is basically the J point, and it ends at the beginning of the T wave. So ST segment is given in the above diagram. It is basically the interval between the ventricular depolarization and ventricular repolarization. Thank you. That's all from the ECG interpretation. That's waveform, segments, intervals. In the next video, we are going to tell you about the normal duration of the ECG waveform. Thank you so much.